Surgery went fine, he's in recovery, but we took a vial of CSF and tested it.
Really?
Turns out the Boeing wasn't the cause of his problems, it was a symptom.
Oligoclonal bands and increased intrathecal IgG.
Which means multiple sclerosis. And the reason it takes three of you to tell me this?
Because we're having a disagreement about whether or not it is MS.
No lesions on the MRI.
It's early. He's had the disease for maybe 2 weeks.
McDonald criteria requires 6 months to make a definitive diagnosis.
Oh, who cares about McPherson? I hear he tortured kittens.
McDonald.
Oh, McDonald. Wonderful doctor. Love kittens.
The VEP indicates slowing of the brain.
Without the lesions, we can't be sure.
Well, if it is, it's gone from 0 to 60 in 3 weeks, which would indicate rapidly progressive MS. Not the fun MS with the balloons and the bike rides for cripples in wheelchairs.
We should wait until we
Start treating him now. Maybe he can walk for another couple of years, maybe live for another 5. Break it to the family. I'm going home.
It'll take months for a definitive diagnosis.
What'll happen to me?
MS is an incredibly variable disease, if it is MS, and we're not 100% sure.
What do you think is going to happen?
There are some medications to manage the symptoms, but as the disease progresses, the problems will become more severe. Bowel and bladder dysfunction, loss of cognitive function, pain.
What's it going to hurt?
The brain's like a big jumble of wires. MS strips them of the insulation and the nerves die. Brain interprets it as pain. But by starting treatment, we're going to prevent that for as long as possible.